I'm joined now by a familiar face to many of our viewers, one of the doctors dealing with the pandemic every day at work. Dr. Larissa Corder is an obstetrician and gynaecologist at one of London's busiest hospitals. Thank you for joining us again. How's your last week been?
So we're still keeping labour ward running. Of course, that's one of our biggest priorities. But I've also spent quite a lot of time doing telephone consultations with patients, trying to explain the situation, giving them advice over the telephone where I can, and sadly having to postpone all non-urgent procedures. So really what we're focusing on is just pulling together all of our resources for frontline obstetric care, which is of most importance now. But sadly, it does mean that non-urgent services are having to be postponed and are suffering as a result of that. The other thing is we're trying to get ready for potential redeployment, so where we may be needed to support other areas of the hospital who are needing to meet demands. But we are worried with a recent survey now showing that 1 in 4 doctors is off in self-isolation and 1 in 5 midwives. So it's making us worry about potential shortages and how we're going to deal with growing demands if we're not getting the testing on the front line.
Larissa, when you're making those phone calls to patients, especially pregnant women, what kind of reaction are you getting? Are people sympathetic to the challenges you're working around right now?
Most people are absolutely great. They really understand the fact that we are under so much pressure at the moment, and we're doing our best to just really streamline all of our resources towards the most urgent and critical of cares. And the obstetric department and labour ward is very much part of that. So most people are absolutely great. But also naturally, people are disappointed with the loss of face-to-face contact, which of course is very important, especially antenatally and postnatally. So some of that will still continue in parts and in areas where we have to keep it going and where women are very vulnerable or they have certain conditions where we absolutely need to see them. So they need to rest assured on that, and we will make all provisions to do that. But the rest of consultations will have to take place either by video call or telephone conferencing. And obviously we've seen in the past few days we've had to make some drastic changes nationally regarding antenatal and postnatal care, and also the number of or one partner being allowed to be present at birth, which is a real disappointment and letdown for a lot of women. But we just haven't got a choice at this particular point in time, trying to keep infection levels low and also trying to protect all of our pregnant women in the hospital as well as our staff.
So just to clarify, right now you are allowed to go into hospital with one birthing partner. Could that change?
Yes, so I mean, you have to check with your particular hospital, but the majority of hospitals are now saying one birth partner, and also that has to be in active labour as well. So you will be allowed that. We recognise that that's really important, but I would advise women to make some contingency plans, because if their partner suddenly becomes unwell or there's any childcare issues that means they have to stay at home, it's really important you elect or nominate someone else to come with you so that you have someone there. But with regards to if you're admitted antenatally and postnatally, once you deliver your baby, sadly, we're not allowing visitors for that because of the infection risk.
It's going to be a very difficult time for people, isn't it? Especially if you have any complications that you can't have your usual support network around you, maybe your mum or your dad or a sister coming in to see you.
Yeah, it's going to be very difficult for a lot of women. We're absolutely anticipating that. And we feel absolutely horrendous about having to make some of these really difficult decisions. It's something that no one wants to do. And we totally recognise that giving birth, makes you particularly vulnerable, and you need your support network around you. So we will encourage people to provide that where we can, so counsellors and also support from the hospital and midwives to visit particularly vulnerable women. But I'd encourage all women to consider doing FaceTime with their relatives and implementing other measures just to help them have that support, even if they can't be in physical contact with the people they would have hoped to.
Presumably most people's birth plans simply have to go out of the window right now. What about home births? Have they been cancelled across the UK? Where are we at with that?
So the majority of trusts have had to really clamp down on home births and sadly rule them out for a number of reasons. The main reason being to keep all mothers and babies safe. So if, for example, you were to have a home birth and there was to be a complication, we just can't guarantee that an ambulance will be able to get to you in time, and that would be really horrendous. So that's the number one reason. But number two, we're seeing with staff shortages, which are only set to get bigger potentially, especially if we don't get the testing on time, then we need to make sure that we centralise and pool all of our care to the hospital so that we can actually ensure we can provide the service that we need to keep labour ward going. Sadly, it's meant, yes, that a lot of home births have had to be cancelled.
Dr. Larissa Corder, thank you once again for taking time out of your extremely busy day. We'll speak to you again soon. Thank you.